Paris syndrome is a sense of disappointment exhibited by some individuals when visiting or going on vacation to Paris, who feel that Paris is not as beautiful as they had expected it to be. The syndrome is characterized by the citation needed a number of psychiatric symptoms such as acute delusional states, hallucinations, feelings of persecution, perceptions of being a victim of prejudice, aggression, or hostility from others, derealization, depersonalization, anxiety, and also psychosomatic manifestations such as dizziness, tachycardia, sweating, and others, such as vomiting. Similar syndromes include Jerusalem syndrome and Stendhal syndrome. The condition is commonly viewed as a severe form of culture shock. It is particularly noted among Japanese travelers. It is not listed as a recognized condition in the Diagnostic and Statistical Manual of Mental Disorders. Dr. Hiroaki Ota, a Japanese psychiatrist working at the Saint-Anne Hospital Center in France, coined the term in the 1980s and published a book of the same name in 1991. Katada Tamami of Nisei Hospital wrote of a manic-depressive Japanese patient suffering from Paris syndrome in 1998. In 2004, Dr. Ota and co-authors wrote in a French psychiatric journal 4 that France was the only European country to offer specialized care to Japanese citizens in their own language, as an agreement between the Japanese embassy and Dr. Ota's department in the Saint-Anne Hospital. In the article, they state that, between 1988 and 2004, only 63 Japanese patients were hospitalized and referred to Dr. Ota. 50% were between 20 and 30 years old. Of the 63 patients, 48 were diagnosed with schizophrenic or other psychotic disorders. Later work by Youssef Mahmoudia, a physician with the Hospital Hôtel Dieu de Paris, indicates that Paris syndrome is a psychopathology related to travel, rather than a syndrome of the traveler. He theorized that the excitement resulting from visiting Paris causes the heart to accelerate, causing giddiness and shortness of breath, which results in hallucinations in the manner similar to, although spurring from opposite causes, the Stendhal syndrome described by Italian psychiatrist Graziella Magarini in her book La Syndrome di Stendhal. Although the BBC reported in 2006 that the Japanese embassy in Paris had a 24-hour hotline for those suffering from severe culture shock, the Japanese embassy states no such hotline exists. Also in 2006, Miyuki Kusama, of the Japanese embassy in Paris, told The Guardian, there are around 20 cases a year of the syndrome, and it has been happening for several years, and that the embassy had repatriated at least 4 Japanese citizens that year. However, in 2011, the embassy stated that, despite media reports to the contrary, it did not repatriate Japanese nationals suffering from Paris syndrome. Of the estimated 1 million annual Japanese tourists in Paris, the number of reported cases is small. A journal which also identified 2 types of the affliction, those who have previous history of psychiatric problems, and those without morbid history, who exhibit the delayed expression type. In an interview with Slate.fr, Dr. Youssef Mahmoudia, a psychiatrist at the Hôtel Dieu in Paris, stated that of the 50 pathological travelers hospitalized each year, only 3–5% are Japanese. The French newspaper Libération wrote an article on the syndrome in 2004. In the article, Mario Renou, the president of the Franco-Japanese Medical Association, states that media and touristic advertising are primarily responsible for creating this syndrome. Renou indicates that while magazines often depict Paris as a place where most people on the street look like models, and most women dress in high-fashion brands, in reality neither Van Gogh nor models are on the street corners of Paris. In this view, the disorder is caused by positive representations of the city in popular culture, which leads to immense disappointment, as the reality of experiencing the city is very different from expectations. Tourists are confronted with an overcrowded and littered city, especially if compared to Japanese metropolis, and a less than welcoming attitude by French hospitality workers like shopkeepers, restaurant and hotel personnel, without considering the higher safety risks to which tourists, used to safer cities, are suddenly exposed. Paris syndrome is a sense of disappointment exhibited by some individuals when visiting or going on vacation to Paris, who feel that Paris is not as beautiful as they had expected it to be. The syndrome is characterized by the citation needed a number of psychiatric symptoms such as acute delusional states, hallucinations, feelings of persecution, perceptions of being a victim of prejudice, aggression.